Gauteng and Western Cape governments and scientists are warning that we are likely to be hit by a third wave in the next few weeks. Some countries have already imposed stricter lockdown regulations. But just how is our government, rather, handling the COVID-19 pandemic? Well, to answer this question and more, I'm joined by UKZN Research and Innovation Acting Deputy Vice-Chancellor-Professor Moshabela. Professor Mosa, thanks a lot for joining us this evening. Well, we've got the countries moved to level 1 of the lockdown. Restrictions have been eased, certainly allowing more movement between persons and the opening up of sectors of industry. How do you think the country is faring in containing and managing this pandemic under these eased restrictions?
Thanks so much, Faith. Greetings to you and your viewers. I think that so far the country did well in coming out of the second wave, but I must say that, we came out of the second wave with a lot of damage, a lot of bruises and a lot of harm. There's been a lot of loss and pain. And right now, I think that even though we are in alert level 1, we know that we cannot be complacent. The reason is that in the background, we can see that the infection rate is increasing. And I know a lot of people are looking at the cases themselves, and they may look like they are low, but we know that the rate of infection is increasing. And for us, we would really like government to be acting now to make sure that we spare people from the kind of harm that we saw in the second wave, rather than wait until it is obvious to everyone later on when we are already hit by the wave before we call for action. Yeah. This, for me, I think that creates a gap in the effort and the actions of the government. We are not seeing that at the moment, and this is the time for them to be demonstrating that they are doing everything they can to contain the pandemic.
Well, Prof, how should they be acting? What should they be doing? Because they've also been criticized that they've been a little bit laxed in the tracking and the reporting of these very same COVID-19 infections.
Look, on the one hand, I understand, they worked hard during the second wave and they took a lot of blows. But now it creates an illusion that it's time to relax, it's time to take a breather, but it's not. And what we would want to see at the moment is for them to show that they're trying everything in their power to make sure that they contain the infection. And I'll give you an example. One is that we should be seeing them doing everything they can to get people vaccinated. All the healthcare workers vaccinated, and I'm not talking about Sisonke and the implementation study, I'm talking about government rollout. We need to be seeing them doing everything they can to vaccinate people with risk factors, the same people who are likely to die during a third wave. We should be seeing them doing everything they can. Very soon, when the numbers of cases increase, they will be asking people to cooperate with increased restrictions and prevention measures and so forth. They will want that to happen, but on the other hand, people will cooperate a lot more when they see that there's an end in sight. If they can see that vaccinations are here, people are getting vaccinated, people are likely to cooperate. But right now, what we are seeing is not necessarily inspiring for people to then cooperate with those regulations. And we need that to become clear as early as now, not when we are already in the wave.
Yeah. Let's stay with the theme of vaccinations, Prof, because on the other side of it, it's also been criticized, or government has been criticized, that indeed they will not reach their target of vaccinating 1 million people by the end of March, and that the dissemination of this information is just not happening adequately enough. So if you're not vaccinating the number of people, you still have the COVID-19 infection and a really looming surge on the cards, given where we're going to go with the long weekends ahead of us.
Yeah, I think that the targets in themselves, they are unrealistic. That's the first thing. And the problem with unrealistic targets is that you make false promises. And when you make false promises and you do not meet them, then you're going to come back and say you're sorry. It looks like things are not happening the way that it's disappointing. And in fact, it does not inspire confidence in what government is capable of. We keep talking about a capable state. Let's see a capable state. And right now, you cannot be making decisions that go against the effort you're making. It takes nothing. It will take nothing for government to reverse the decision they've made about AstraZeneca and allow people who are willing to be vaccinated with the AstraZeneca vaccine to be vaccinated. And it will go a long way in helping us get closer to where we would like to go. People may disagree on this, but the truth of the matter is that some people would be willing to take the AstraZeneca vaccine. And then they need to make sure that they set realistic target and they demonstrate to us as South Africans all the efforts they are making to ensure that we get the vaccines that we need and make sure that there is a sense of agency. We want to see that effort. We want to see the sense of agency that they have. We are not seeing that.
Yeah.
As soon as we start seeing that, then we can actually be a little bit more supportive to the efforts that they are making and the challenges that they face.
Do you think that government will therefore be able to meet their targets? I mean, we've already spoken about how the March target, it looks as though it's a far off or a distant off objective right now. But at the end of the year, there was a target also of vaccinating a significant amount of people. I think about like a third of South Africa, 2/3 of South Africans needing to be vaccinated. Are we heading towards even reaching a fraction of that target that's been set?
You know, the false promises, the breaking of timelines and all of that gives us no hope in terms of what we can vouch for what government is able to do at this point. We really cannot speak on behalf of government and what they're capable of doing. And that in itself has become a problem for those of us who basically have to make an effort in communicating what is happening behind the scenes, in communicating what people need, or the questions that, in addressing questions that people have. Here's the thing. We want government to make sure that all healthcare workers are vaccinated. We want government to make sure that people with risk factors are vaccinated as soon as possible. And right now, it's no longer about whether we are anticipating or projecting when government will meet what. We want government to achieve that. And I think the sooner we make it clear that this is what we are calling for them to do, and make it very clear that we need this to happen as soon as possible, because this is the difference between lives lost and lives saved. This is the difference between economy saved and economies lost. All of these things matter. And so government needs to understand that this is what we want. And it's not a matter of option or whether they can come back and apologize. No, we don't want the apologies. We don't want them to come back and say we are not meeting targets, just because right now it's about accountability. Nobody holds them accountable. And right now we want them to account, because we cannot go through what we went through in the second wave. And this depends on them making sure that they're rallying everyone and all the resources to make sure that people get vaccinated.
Professor Mosa, we'll leave it there for this evening. Thanks a lot for joining us there, shedding some light in terms of exactly how are we managing and containing this COVID-19 pandemic. And it looks as though there are a lot of holes when it comes to unanswered questions, and the government needing to pull up their socks, according to analysts. Research and Innovation Acting Deputy Vice-Chancellor-Professor Moshabela.